Hello, my name is Deborah Brownback. I'm a registered nurse, and I want to thank you for attending my community plan presentation. My community plan was with the Central Baptist Church, where I assisted the lead pastor in forming a comprehensive policy and procedure concerning the COVID-19 pandemic and infectious diseases for the congregation, volunteers, and church staff. What is a community plan? A community plans are used to assess health issues and implement a plan to help improve the noted needs. When writing a community plan, it is imperative to know what a community health assessment and projects are essential for improvement within the appointed area. A community health improvement plan, or CHIP, is a long-term endeavor to address public health problems based upon the community health assessment along with health improvement process. In Florida, What is a community plan? A community plans are used to assess health issues and implement a plan to help improve the noted needs. When writing a community plan, it is imperative to know what a community health assessment and projects are essential for improvement within the appointed area. A community health improvement plan, or CHIP, is a long-term endeavor to address public health problems based upon the community health assessment along with health improvement process. In Florida, Seminole County has a community health improvement plan called CHIP, updated every 3 years, and the current issue is from 2017 to 2020. The benefits of completing an assessment improvement plan are to improve organizational and community coordination and collaboration, increase knowledge about a public health and the interconnectedness of activities, strengthen partnerships within the state and local public health systems, identify strengths and weaknesses to address in quality improvement efforts, and baselines on performance to use preparing for accreditation, and benchmarks for public health practice improvements. While completing the community health plan, there is a need to define the community, develop a windshield survey, complete a community assessment, identify community partners and resources, create a community diagnosis and objectives with SMART goals, and then finally put all the elements together with interventions and planned evaluations while updating goals and promoting positive outcomes for the community. Definition of a community. The city of Sanford comprises of many communities, and the meaning of communities is typically defined by a geographic area, characteristics such as religion, race, age, or occupation. People that live within a community come from different backgrounds and unique cultures, customs, and values. A community needs assessment provides community leaders with a glimpse of local policy, systems, environmental changes, strategies currently in place, and help identify improvement. Using the data found in a community needs assessment can map out a course for health improvements by creating strategies to make positive and sustainable changes in their community. One of the ways Seminole County assesses community needs is in the Community Health Improvement Plan. It was developed in 2016 by the Florida Department of Health and a participation in a collaboration effort with hospitals and surrounding health departments to develop a comprehensive community health needs assessment. Community Windshield Survey. The importance of a windshield survey for community is observing the characteristics and assessing the area. Evaluate the needs of the city and estimate the poverty level for physical, social, or economical characters along with the age of the community, infrastructure needs, businesses and industry, location and condition and use of public space, amount of activities on the street, the noise level, movement and traffic, and the location and shape of the city or city hall and courthouse. Analyzing the information collected from completing a windshield survey will give a view of the community that can help decide how to make the next steps effectively and address real needs and improve quality of community life. In the county of Seminole, we have 81 churches from many different religious faiths. The statistics of religion in Seminole County are 41.2% practice religion, with 16.4% Catholic, 5% Baptist, and with many other faiths represented. Many religious buildings in the community have appearance of being well maintained and straightforward, with architect customarily associated with religion. Seminole County has social services such as United Way, the Affordable Care Act, Benefits.gov, food stamps, free reduced lunch programs, health insurance marketplace, making home affordable, Meals on Wheels, Reemployment Assistance Center, Right Service, Right Time, Second Harvest Food Bank in Central Florida, Seminole County Partners, CHIP, Welfare, and WIC. The most exciting thing about Seminole County, Florida, is the fellowship and caring for the people along with the beautiful state scenery. Community assessment data consists of number and density of population, demographic structure of population, vital statistics, disease incidence and prevalence for leading cause of mortality and morbidity, health facilities and healthcare providers, and analysis data to search for significant themes or trends. The city of Sanford, Florida population is 60,035. Sanford population breakdown by race is white is 63.55%, black or African American is 26.36%, Asian 3.20%, American Indian 0.33%, Native Hawaiian is 0.01%, mixed race is 4.41%, and other races is 2.14%. Demographics on the structure of the population. Sanford has a median house income of 2018 for $39,989. Also in 2018, the unemployment rate was 7%, but today we have a percent of 15% due to the pandemic of COVID-19. The housing value is at 37% lower than the state of Florida, with a median house value of $105,000. High school graduates from Sanford is 83%. Test scores are 52% and 5% higher in the U.S. The student-teacher ratio is 13:1. That is 20% lower in the U.S. The cost of living is 12% lower than the state of Florida and is 87%, which is 13% less expensive in the U.S. The crime rate in Sanford in 2018 was 4,246 and 65% higher than the U.S. Although 1 in 24 chances of being a victim and the year-to-year crime is negative 25% and has declined. Reviewing the city's demographics from 2018 paints a fair picture and helps potential families think of relocation to Central Florida. Now to vital statistics. They are the records the community has that counts birth, death, marriages, and divorces. For 2019, there was a total birth rate of 4,647. For the last 365 days, the death rate has been at 265. The state of Florida does not post yearly statistics for marriages and divorces. Next subject is the disease incidence and prevalence. One of the challenges in Seminole County is people without health insurance under the age of 65, which is 12.6%. Seminole County, Florida has a disability rate for people under the age of 65 between the years 2014 and 2018 is 6.9%. Thankfully, Seminole County has multiple social services that helps them with part of this problem. The leading cause of death from 2018 to 2014 was cancer, heart disease, chronic lower respiratory disease, and unintentional injuries and diabetes. Also, obesity rates are at 27% of adults and follow the state trend with poisoning, falls, and motor vehicle accidents is of the top causes of unintentional deaths. Falls and poisoning account for more than 59% of all intentional fatal injuries. Adults with poor mental health days are of 14 or more in the past 30 days shows an upward trend in the non-Hispanic. White population with residents making more than $50,000 annually and those with educational levels above the high school are making less than $25,000 per year. Now to the health and healthcare providers. The population that lives in Sanford, Florida are very fortunate due to overwhelming abundance of physicians, clinics, freestanding ERs, and hospitals. There are 5 significant hospitals, which is Central Florida Regional Hospital, that's where I work at, Advent Health of Altamont Springs, Oviedo Medical Center, Advent Health of Winter Park, Encompass Health and Rehab Hospital, Orlando Health, and South Seminole Hospital. There are 18 medical clinics, 14 nursing homes and rehab centers, and 16 physicians groups are all easily accessed by significant Interstate I-4 expressways that go from almost any point in Seminole County. Also, to get health care, it's approximately 15 minutes or less to get there. Also, Orlando, Florida, which is in Orange County, is only 15 minutes away with another significant numbers of physicians, clinics, and hospitals. Approximately 50 miles in all Seminole County directions, every type of physician specializes in standard and uncommon diseases. Now to go to the analysis data to search for significant trends and themes. The community health improvement process is a strategic collection and assessment of essential health data provided by the communities with information to determine the local and national threats to health and the awareness of emerging health issues. Collaboration with community partners is helping developing, monitoring, and evaluation action plans will help support prioritize health-related issues and establish accountability concerning obtaining measurable health improvements and quality outcomes. The force of change for Seminole County addresses threats and opportunities that can be identified and addressed in making positive changes. The financial details are the cost of healthcare rising, cost of living, disproportionate to wages, low and fixed income for seniors and disabled, aging population, foreclosures, and Social Security concerns. The health forces are access to care, shift to prevention care model, increase in the rate of obesity and overweight. The social forces are health illiteracy, a preventative versus treatment, family support, and a behavioral health awareness. The environmental force are clean water, the increased traffic, housing, countywide building, healthy food availability, and Zika-like infectious disease. The political force are access to jobs and education, trust in politics and government, change in board regulatory function, and the loss of public health and prevention funds. The technical force impacts changes such as in telemedical, education and training, distracted use of devices, and confidentiality. Another assessment called the Community Things and Streams are created to gather thoughts, opinion, and perception from community leaders such as community conversations, consumer surveys, and stakeholders to identify. The following themes are identified: affordable health care, inactivity due to physical pain and emotional health, substance abuse, access to quality and nutritious food, affordable housing, needs and access to mental health services. Also, the healthy infrastructures such as biking and walking. Food security and chronic diseases such as diabetes and obesity, and an appropriate use of the emergency room. Identifying community themes and strengths will allow for corrective actions to assist the county in finding suitable solutions. The community partners and resources are essential components for a thriving community project. Educating a community against potential health threats, such as the COVID-19 pandemic that is worldwide, and protecting them while promoting safety is critical for health promotion. The COVID-19 epidemic has caused a virtual shutdown for the world. In Central Florida, we have progressed through phase 2 to phase 3, regathering that promotes safety for all communities that will allow businesses and social events to restart. The city needs education and interventions to help with this endeavor, and by partnering with the local health officials will benefit from a smooth transition. Central Baptist Church has a strong presence here in Sanford, Florida, with a total of 1,498 members. They have 15 paid employees, 20 unpaid deacons, and a multiple other unpaid volunteers that work with traffic, kitchen, teachers, and teacher aides. The development of a policy and a procedure will provide a guideline for the church employees and volunteers to continue to help the congregation and outreach programs through gathering. Collaboration with the church, city officials, and Florida Governor DeSantis, the population in Central Florida may resume with all previous meeting while promoting safety and decrease possible infection rates. Following the Center for Disease Control and Prevention and the State of Florida's Health Department guidelines will continue to provide the best information. Central Baptist Church is the first community partner while clinical site for regathering the congregation and outreach programs. The church staff is aware of the need for policy procedures to promote safety within the community. As we all know, Florida has been a hotspot for COVID-19 pandemic. Their role during the project is to help with information, the design of the church and classrooms, when and how the congregation meets, any outreach programs, and assist with the plan for recommended social distancing. Currently, the state of Florida continues to have a mandate for wearing masks and social distancing. The other community partner is the lead pastor. He provides needed guidance with the staff and volunteers and provides the information to help facilitate the program's requirement. Along with the team, he continues to work hard to maintain the state mandates for social distancing and to prevent groups of people from gathering. His role has been the go-to person to answer questions and receive essential information concerning the city of Sanford, Florida, status concerning the congregation regathering. His role and responsibilities are promoting healthy hygiene practices such as supplying hand sanitizer throughout the church entrances and exits, the wearing of facial masks, promoting social distancing, and the cleaning and disinfection ventilation of the sanctuary where the members congregate. Next comes the community resources. The first one is the Center for Disease Control and Prevention. The article, Considerations for Communities of Faith, is a guideline to help assist churches in the United States to prevent the spread of COVID-19. Their procedures consist of scaling up operations, promote healthy practices, mask, cleaning, disinfecting, and ventilation, promote social distancing, nursery and child care, checking for signs and symptoms, staffing and training, plans for when staff or congregation becomes sick, maintain health operations and signage and messages. The CDC provides general considerations to help communities of faith recognize how to practice their spiritual beliefs while keeping the congregation and staff safe. Another community service that works with the health department is the Prepare Seminole Office for Emergency Management, with a clear executive order regarding the mandated social distancing and facial coverings required. The information provided through the website is for the communities in Seminole County regarding what to expect of how the citizens should behave during a pandemic. Most important is information controlling testing sites and other different options provided for ways to be tested for the COVID-19 virus. Collaboration between the stakeholders and the community resources interpret a workable solution within the community to prevent new infections. Developing community health diagnosis. A community is a group of people with at least a common characteristic such as geographic location, occupation, ethnicity, and housing conditions living in a broader society. The definition of a community diagnosis is a comprehensive assessment of the community's health status concerning the social, physical, and biological environment. Thus, the purpose of community diagnosis is to define the existing problems, determine available resources and interventions for planning, implementing, and evaluating goals by and for the community. For Sanford, Florida, the current pandemic of COVID-19 has caused multiple economic and social problems. Currently, Phase 2 to Phase 3 for the regathering of the society process will help the community return to normal in a few months. The population needs education and interventions to assist with this project. By partnering with the local health department and the Centers for Disease Control and Prevention, the spread of COVID-19 will stop and be eradicated once a vaccine is created. The nursing diagnosis for the community of Sanford, Florida is the risk for COVID-19 transmission among Sanford, Florida citizens is related to a knowledge deficit evidenced by the city's rise in infections. Next is a community health plan for Central Baptist Church, a brochure with information concerning the federal guidelines for the state of Florida during the COVID-19 pandemic, and then also the development of a comprehensive policy and procedure for COVID-19 and infectious This is the brochure that was developed for Central Baptist Church to hand out to their congregation, to their church staff, and also to volunteers. This is a copy of the Central Baptist Church Policy and Procedure for Infectious Disease and COVID-19 Plan. Proposed interventions for community health plan. Central Baptist Church will, the congregation, volunteers, and church personnel will immediately practice social distancing per CDC guidelines. The congregation, volunteers, and church personnel will demonstrate the proper mask facial coverings used by the end of education. The congregation, volunteers, and church personnel will demonstrate proper hand washing with soap and water for 20 seconds or use hand sanitizer placed at the church's entrance. The church, volunteers, and the church personnel will follow state, federal, and local laws and regulations about continuing church services, classes, outreach programs, and outside activities. The congregation, volunteers, and church personnel will continue to limit sharing frequently touched objects such as Bibles, hymnals, bulletins, books, or items passed around among the congregation. According to the Centers for Disease Control and Prevention, the objectives for the community project for Central Baptist Church are policies and procedures for the COVID-19 pandemic and infectious disease guideline. The policy and procedure guideline developed will provide education and interventions for the congregation, volunteers, church employees, and outreach programs to promote safety and decrease infection rates. The impact of COVID-19 for Seminole County, Florida, as of October 21st, the total count for the state is 762,534 positive cases and 16,210 deaths. With the recovery, though, of 746,324 has recovered from the virus. Proposed evaluation method for community health plan. The Communities Project short-term goal is for the people associated with Central Baptist Church to immediately adhere to government mandates per the CDC guidelines to help prevent the spread of COVID-19 or other infectious disease. Also will be monitored by the church personnel and volunteers before, during, and after any classes or meetings. The evaluation will be done weekly during the staff meeting with revisions if needed. The long-term goal for Central Baptist Church is not to have an infectious outbreak of COVID-19 with the church's congregation. In case of an infectious disease outbreak, the county's health department will be notified and on-site disinfection of the area and the building will be done. It will not resume meetings until deemed safe by the Department of Health. The county project for Central Baptist Church is developing a policy and procedure guideline for the COVID-19 infectious disease. The lead pastor is responsible for implementing the new policy and procedure guidelines and interventions to have been put in effect immediately in September of 2020. Still, the final guidelines will be executed in the third week of October 2020. The primary goal for the church is for the safety of the congregation, volunteers, and church personnel. The church has been careful in the past and was shut down from March 23rd until June 9th, per the local government statutes. The church congregation, volunteer, and personnel are instructed before entering the church services, instructions during the services, and dismissed in sections with education at the end. Instructions are via video on the large screen monitors throughout the church. Also, a brochure has been made available at the entrances for easy access. The policy and procedure policy has been made available for the church staff and leaders. The church's team has been receptive and committed to adhering to the policy and procedure guidelines. Weekly meetings with educational updates has been successful and so far effective with short-term and long-term goals but the most successful is there has not been an outbreak of COVID-19 within the church. The ongoing primary goal is continuing education and reevaluation and revision to the policy and procedure for the COVID-19 or any other infectious disease process. To summarize, to complete a community plan, you need to have a definition of community, a windshield survey, community assessment, community partners and resources, a community diagnosis, community health plan, interventions, and evaluations. The city of Sanford, Florida and Central Baptist Church has been one of the front runners to provide a thriving community for its population by meeting their needs. Communities in Seminole County, Florida, and the hospital system work together to provide the highest quality of health care given with the Florida Health Department's assistance. The diversity in Sanford, Florida is renowned for its equality and justice and promotes unity within the community. Along with the development of the Community Health Improvement Plan for Seminole County 2017-2018, also called CHIP, are required every 3 to 5 years by all 67 county health departments of Florida to monitor and evaluate success priority areas. The recognition of a community overall health status is essential for the community to thrive, and using the key indicators help develop correct solutions, educate the community by promoting primary and secondary prevention, lifestyle changes. Cancer is the leading cause of death, with heart disease, respiratory disease, unintentional injuries, and diabetes. Utilizing primary preventative measures may help the community to promote health. Due to easily accessible expressways and highways, the people in Seminole County only have to commute a few miles or within 15 minutes for their health care needs, such as hospitals, physicians, clinics, and ERs. The force of change and community themes and strengths for the Community Health Needs Assessment and the Community Health Improvement Plan, Seminole County and cities will continue to improve by staying vigilant, will prevent poor health care outcomes. The community assessment and diagnosis and the analysis data help define needs, strengths, barriers, opportunities, readiness, and resources. Implementing the interventions needed for the community and follow-up evaluations that need monitoring and reevaluation periodically will help ensure success for any healthcare project.